today to
this
talk about this event.
Recorded.
Thanks, Jatinder. We're here today to hear about a really fascinating book. It's one close to my heart. It's called Beyond the Hype, the Inside Story of Science's Biggest Media Controversies, and it's by Fiona Fox. This is a book published by Elliott Thompson. Fiona is the chief executive of the Science Media Centre, and it's known as Britain's independent science press office. It was set up in 2002, and she'll tell you more about it, but of course that means it's celebrating its 20th anniversary. And the team work really closely with respected scientists and science journalists to make sure that everyone is on the same page, everyone gets the latest information in a non-sensational way. And Fiona has received a lot of accolades for her work and for service to science. She's got an OBE, she's got honorary fellowships with the Academy of Medical Sciences, the Royal Society of Biology, and the British Pharmacology Society. She's also been called the Alistair Campbell of science PR. I'm not sure whether she likes that or not, but welcome to you, Fiona. It's great to have you here. We are going to just have a few notices before we start. Just to give a plug, the Guild is a great organisation to belong to. It only costs £50 a year. There's lots of networking events and other events like this. We've got our big networking event coming up next Thursday. It's at Carlton House Terrace. You can book tickets on the website, so please do if you haven't already. So let me pass over to Fiona. I just wanted to start off, obviously we've got the book, here it is, very exciting. But just tell me a little bit about, why you started the SMC, and just to give you a little personal background. I was one of the journalists who I think Fiona was trying to attract back in those days. I started The Sun in 2000, and the SMC started in 2002. And so, yeah, without any naming and shaming, Fiona, what was it all about?
So, well, first of all, thank you for inviting me. I was delighted to get this invitation. Secondly, Jacqui said I could have a glass of wine. So here's to you all. I'm going to have a glass of wine when we speak. So yeah, Jacqui, as you say, you were definitely one of the journalists we were trying to influence at that time. And it was basically, if you think back, it was the time of kind of MMR, GM crops, animal rights extremists. It was just a time where there'd been a lot of media frenzies about science, and it was perceived by the scientific community that your average academic scientist was not engaging very effectively. You had on the GM debate, for example, you had Greenpeace and Friends of the Earth, these really media savvy organizations dominating the coverage, and these mild-mannered plant scientists in Rothamsted Research and John Innes Centre were just this. And similarly on MMR, people might remember groups like Jabs, very emotional, very good campaigning groups, kind of really convinced that the MMR jab had damaged their children, who were also kind of very effective at doing media work, whereas a lot of the vaccine experts weren't. So yeah, we were kind of the scientific community's response with this very vague idea that I was given when I was appointed of just improving the relationship between scientists and journalists, and through that hopefully improving the kind of accuracy and quality of the information reaching the wider public.
And of course, I remember when you started, it was relatively small groups of journalists would come to the briefings, and now it's expanded hugely. You're in different locations, you're at the Wellcome Trust, you've got lovely offices there, and you get hundreds and hundreds of journalists visiting before the pandemic, and now you've gone virtual. Could you just give me a little idea about the scale of what you do?
Yeah, that is really true, actually. And I think one of the things we've reflected on ourselves is that we kept a specialism in news. We always decided we will be a very good press office for when science hits the headlines, and our focus would be on the news journalists. So Jacqui, you say you were a journalist for The Sun, you were in the news section of that. And I think that focus has really served as well, because a lot of you, you guys will know this as well as me, but a lot of university press officers and the Research Council have kind of diversified a lot. So they're multimedia officers, they're doing a tiny bit of work with the news media, but they're creating their own content and running YouTube channels and going on social media. So I think what's really happened is that this focus on news has served us really, really well. And now all the scientific community and the universities, they'll do all their own thing in terms of public engagement and events. But if they actually want to get a story or a new piece of research to news journalists, they'll come to us, and it's become a kind of virtuous circle. So during the pandemic, we ran 200 press conferences. So all of the big clinical studies commissioned by the government, we ran press conferences for all of them. And we even had international journalists wanting to join the list. So very, very, very long list. So you're right, it was, we for the vaccine, Oxford vaccine briefing, I think we had 200 journalists sending that briefing online. So yeah.
Oh, I didn't know that you'd expanded to international attendees.
Not deliberately, and there are other SMCs around the world all serving their national audiences, but because so much of the science, to be fair, we've done very badly in some ways in the pandemic, but one of the good things that the UK did was the science and the research and the clinical trial, like recovery on the drugs and the Oxford vaccine. So we ended up with quite a lot of international journalists saying, can we hop on, because we want to hear from Sarah Gilbert about the vaccine. So we've actually got a bit of a decision to make now as to whether we keep them on or go back to our kind of UK-based journalists.
Well, look, tell me a bit more about the book. You're a very busy lady. Tell me how that came about.
Well, I am a busy lady, but I should say that, you made the point that we started very small. There were only 2 of us back in 2002. We're now 9 staff. Actually, in the sleepy summer of 2019, I was thinking, well, the SMC is ticking away. I've got this fantastic group of press officers, and I did feel like I need a bit of a project. And the chairman, who's ex-BBC, ran the College of Journalism, Jonathan Baker, just encouraged me to take a sabbatical and do something over those summer months. And I just wanted to write this book because like I said, there are other SMCs around the world, and they would, a group would come from Spain and say, tell us the whole story of the SMC. Like, what is your spirit? Why did you start? What are the kind of values? What is the approach? And I found myself repeating that story to every new member of staff, to other global SMCs. And so the project that I decided to do in July and August that year was to write up the big stories that we've been involved in: ClimateGate, GM, MMR, the Fukushima disaster, to write them up with also the kind of messages about how each of those stories fed into this approach that is the SMC approach. So it's like a kind of archive, a legacy. And then, of course, what also happened just as I got a publisher was the pandemic hit. And I remember my chairman and the publisher saying, well, I'm sure you could do both. And I almost was like, really? I don't want to do both. This is the biggest science story I'll ever be involved in, and I don't want to be part-time on it. I want to throw myself into it. So the whole thing was put on hold. And then, as you say, rather neatly, by the time I emerged for breath, it was also our 20th anniversary. So it became quite a good project for the whole of the team, really, to have a book to mark the 20th. And I also could add a chapter on the pandemic.
Now, obviously, as a journalist, a news health journalist, I loved it for all the names that are in there of people I knew. And you were very discreet, because if you were criticising somebody, their name wasn't in there. So I thought that was quite clever. But it has kind of a gossipy, intimate feel, Fiona. I mean, what's the reaction been from the science and health journalists that that come to the SMC?
Actually, it's been really, really nice. You're right. There were a couple of people. I think I tell a story about Ben Spencer. He's a very brilliant health reporter on the Daily Mail, and he's now moved to the Sunday Times. And let's put it like this: I come out better in this story than he does. It's about a row we had at the end of the press briefing about statins. And I told him in advance that I was going to do that. And I said, actually, if you really, really object, because I really like him and respect him, then I won't put it in. And he was, to his credit, he was absolutely fine in it. So I don't think anyone's been offended. I think a lot of the science journalists, for exactly the same reason you've said, Jacqui, really like it because they remember all of these stories. There've been a couple of people who disagree with some of the stuff. There's a guy who's actually a journalism academic who was really annoyed with me because we're on the chapter on human-animal hybrids. I make the point that he was saying that in a way, the science dominated that debate. The ethicists and the kind of pro-lifers were shoved out of that debate because the scientists were so all over that. And I think I made a comment about how we plead guilty to dominating this debate and driving out the Catholic Church. And he was rightly, I think, said, actually, it was a much more subtle point. We do need the public to see that science is one side of these debates, but actually religious groups are another side, and ethics debates are another side. So I thought that was reasonable critique. So, but on the whole, really, really lovely. It's been a lovely experience, actually. I was worried about aggro and everything, but actually everybody's been really, really nice about it.
Now, you asked me to think about some bits that you might want to be reading, and we're going to hear a bit in a minute about the sacking of David Nutt, the government's drug czar. But what was your favourite bit in it, would you say?
I liked those stories that told themselves. So when I was sitting in July and August in a little house in Donegal overlooking the sea, which is very lovely, the story of ClimateGate told itself. The story of David Nutt being sacked told itself. The story of the government coming out and saying we're going to ban research on human animal embryos told itself. The story of Tim Hunt and everyone phoning me up saying you've got to help this guy, he's like in the middle of an international storm. Because I've got a terrible memory for names, can't remember anyone's names anymore, but I remember the sequence of events. And so I was just sitting, I didn't need to research. And because it's explicitly a book about my memories, I loved those. And I loved the kind of funny memories I have, which you'll hear a bit about what else was happening when I was trying to deal with these stories. The bits I really didn't like was actually about what is the situation with science press officers? How are they changing and characterizing something? Because that's a really hard thing to do, isn't it? To have a chapter in a book that is describing what has happened to science journalists in the last 20 years and what's happened to science press officers. And that was more like the hard book, whereas the rest was, somebody said to me, it's like part memoir, part manifesto. It was the memoir bits that I enjoyed, and the manifesto where I've got to articulate a vision was quite challenging.
I would recommend to the the journalists on this call to read to read all of it, but to read the chapter about you talk about the press officers, because I found that as a journalist fascinating how the nature of that job had changed, and about you talk about brand management. And the university think that is more important than actually helping individual journalists. And I've had that experience myself recently of that they don't have much time to speak to journalists because of all the other bits, and so it's hard sometimes to get a comment. And I think that's something that we can all share and we might discuss later on. But yeah, so I think I enjoyed that particular bit. So look, I think we're going to hear a bit now from you, Fiona. To say that I look back on now, and I used to quote David Nutt a lot when I was at The Sun. He was, a paper like The Sun always wanted, the risks and the scandal. They didn't like to hear things like alcohol is more dangerous than Class A drugs, which is effectively what we'll hear David Nutt was arguing. He was always somebody who would talk to journalists and give you a good line. So there we are. But I think, Fiona, we just for a few minutes now, if you're going to read from that chapter, that would be great.
Great, thanks, Jacqui. So this is chapter 5. It's called The Sacking of David Nutt, the Politicisation of Science. It took me several years to realise the full extent of the government's control over the media work done by scientists whose public funding means that they're in some way connected to the corridors of power. I wish I'd remained in blissful ignorance for longer, because once noticed, this quickly became one of the biggest frustrations of my working life. Our remit at the Science Media Centre is to remove the barriers that prevent scientists from engaging with the news. Well, one of the biggest barriers in the UK right now is the knock-on effect of centralised government communications encroaching into the media work of publicly funded scientists. It's a complex issue, and as broadcasters might say, other interpretations are available. Here, you're only getting my view, that of a press officer heavily biased in favour of separating science communication from government communication. But I believe there is a fundamental principle at stake. Science communications, like science itself, should be free from politicisation and separated from a system that is set up primarily to communicate the priorities of the Prime Minister and the departmental ministers. If there are controls and restrictions on scientists talking to the media and the general public, then we do not have sufficient transparency. I heard the news that Professor David Nutt had been sacked as the government's drugs czar in late October 2009, while I was driving my young son Declan to the cinema. It was half term, and so far my plans to spend time with him had been largely thwarted by events at work. I was determined to have one day off and arranged a cinema trip. It was Declan who took the call from a colleague and relayed the news as we were driving on the busy North Circular. My initial shouty expletives were followed by my instructions to Declan to call some of the other names in my phone to break the news and tell them I would be in touch very soon. This quickly got confusing. At one point, Declan informed Mark Henderson from the Times that Mark Henderson had been sacked. No one could accuse me of being a slick PR operator. I didn't abandon that cinema trip, but I had to sneak out of the film for a while to work with my colleagues to gather responses from across the scientific community. Professor Nutt is one of the UK's leading neuropsychopharmacologists, specialising in research on drugs that affect the brain. In January 2008, he was appointed by the Home Secretary, Jacqui Smith, as chair of the Advisory Council on the Misuse of Drugs, ACMD, or the Drug Czar, as the role is referred to more popularly. The news of his sacking less than 2 years later wasn't entirely a shock. Earlier in 2009, Nutt had been very publicly taken to task by Smith after doing media work on a study he published that suggested the risks involved in taking ecstasy were statistically no more significant than those of horse riding. Smith had taken to the airways to rebuke her own drugs advisor and demanded he apologise to the families of young people who died after taking ecstasy, saying, "I'm sure most people would simply not accept the link that he makes up in this article, horse riding and illegal drug taking." Good scientists, of course, do not make things up, and Professor Nutt is a very good scientist, one who for some years had been speaking in the media about his scientific work on evidence-based approaches to drug classification. He cited research in support of his conclusion that illicit drugs should be classified according to the actual evidence of the harm they cause, pointing out that alcohol and tobacco cause more harm than LSD, ecstasy, and cannabis. Smith's objection to Nutt was not based on a critique of his methods or the reliability of his conclusions. Her problem, it seemed, was that his findings were inconvenient to government policy and deeply unpopular with sections of the public and press. After a day of headlines reporting the Home Secretary's call for him to say sorry to bereaved parents, Nutt actually did issue an apology. I was upset at his decision to do that. He was not a politician who had made a gaffe and needed to apologise to save his career. He was an eminent scientist discussing his research findings in the pages of a learned scientific journal. I called him that night to ask why he'd agreed to apologise. He explained with a heavy heart that he'd done so because he felt he could do more to achieve an evidence-based drugs policy by staying on as chair of the ACMD. But ultimately, his apology was not enough. Fast forward 8 months and Alan Johnson was now Home Secretary, but the tension between minister and advisor remained. Things came to a head thanks to a scientific lecture that Nutt had given, comparing the relative harms of drugs, including cannabis and alcohol. The lecture itself had been delivered months earlier at King's College London, and the evidence he drew on had been published in peer-reviewed journals, notably the 2007 paper in The Lancet about scales of harms from different drugs, including cannabis, alcohol, tobacco, and harder drugs like cocaine and heroin. As chair of the ACMD, Nutt had to submit such talks to officials at the Home Office, and on that occasion they had given him the all clear. But in October 2009, his speech was published as a review article by the event organisers and picked up in the press. It was amid the resulting furore that the Home Secretary announced they had sacked him. If Nutt had been ready to bend to the government after Smith's warning, he was in no mood to go quietly this time. Like other scientists before and since, he learned the hard way that if you fall out of favour with government, the government press officers who are meant to be yours are more likely to be briefing against you than setting up your interviews. This was exactly the kind of story the Science Media Centre was expected to work on. You're still on mute, Jacqui.
Well, I'm a professional moderator, would you know. Thank you, Fiona. That was great. And of course, you know, the postscript is that in actual fact, the sacking didn't lead to his, you know, lack of power as an academic. He's gone on to do some fantastic work and is very, very well thought of internationally, isn't he?
Absolutely, and I think I make the point that at the end, in terms of who won the PR war, 100% David Nutt. He went from, well, the next bit of the chapter is that he did a press conference with us, with, as you said earlier, Jacqui, like 30 or 40 journalists crammed into the room to hear him. Meanwhile, the Home Secretary didn't even put up a defence. They went quiet, and David Nutt went very loud. So yeah, I think he prevailed.
Okay, thanks. Well, I'm going to just ask a couple of more questions before opening to the floor. I think, just a couple of things would be, what's your advice to health journalists currently wanting to navigate science stories? And also, where should journalists be looking for stories? What do you think the hot topics will be in the next few years?
So in terms of navigating, I think just working, and I feel like this is, you lot know the answer to this better than me, but I think just kind of working out who you trust, who are the respected sources. It doesn't mean you can't take voices from a full spectrum of opinion, but knowing which scientists are, respected, publish in peer-reviewed journals, present at scientific conferences. I know sometimes journalists say to me, the maverick can sometimes be right, but 99.9% of times the mavericks are wrong. And the really good science is coming out of, our top universities, our learned societies, our journals. So I think just working out who you trust to go to for stories. And if in doubt, so I don't feel like saying it to this distinguished group, but certainly for younger journalists, and we do, Jacqui, you will that when people like you left the Sun, and then Mark Henderson left the Times, and they're replaced sometimes by these 21-year-old ex-general news reporter, and you did really feel like, Jacqui, you probably didn't need the SMC as much. Certainly Mark Henderson or Roger Highfield on the Telegraph didn't really need us. You already had brilliant contacts. But for these younger journalists, I think, coming to the SMC, we've got a database of 3,000 scientists, and we've done a lot of the kind of quality checking. In terms of where the big news stories are, it's very, I'd be interested in hearing your views on this, but it's very difficult emerging from a story that was the only story for 2 years. That has never happened before. We've always had 4 or 5 press officers working on, someone will be working on climate change. I did, as is reflected in the book, I did a lot of our fertility stories and our human animal hybrids and mitochondrial DNA. Remember that, baby with 3 parents. So I was always in that arena, and I haven't touched that for 2 years. And in fact, we were sitting in the office the other day saying, the legislation to allow the baby with 3 parents happened 3 or 4 years ago. Is there a baby? We don't actually know. And there was a waiting list of people who wanted to go to Doug Turnbull from Newcastle and Mary Herbert, who were offering this treatment, come and have a baby free from mitochondrial disease. We don't know if there's a baby. So I feel like I need to throw myself back into all that. But I do think that, and genome editing, definitely genome editing, especially with the government now kind of saying that post-EU directives, they can regulate on a kind of UK level and allow more genome editing in animals and humans. So I think that's one to watch. What else? Obviously viruses. I think there will be a continued interest. Obviously the hepatitis story, monkeypox today, we've been responding to. So it's a bit like when I used to work for an aid agency, if there was floods in Mozambique, suddenly journalists were interested in Mozambique for a year. So I feel like, infectious diseases, global health might stay on the agenda, which will be nice. So yeah.
Great. Thank you, Fiona. Well, I'm going to throw open the questions to the floor. So please do turn your cameras on if you wish. We'd love you to see your faces. And I wondered if you've got a question for Fiona, then please do either put your hand up like this or do the thing on the chat down below. So please don't be shy. Right. Yes, Sarah. So thanks.
Sorry, trying to unmute. Hi, Fiona. I've been on national newspapers. I was just trying to work it out since the 80s, and also doing current affairs documentaries. Strands like Panorama Dispatches, all that lot. One of the things that has dominated those early years, I think, was the influence of Big Pharma. And the fact that, you know, you were talking about the scientists at universities, but in many cases, scientists at universities are funded by Big Pharma, or the universities are funded by Big Pharma for the scientists' discoveries. And it seems to me that where you have a discord between health research for the benefit of people, mankind, whatever you like to call it, and health research for the benefit of an enormous corporation, you are bound to have media problems. And I wondered what you would say about that.
Yeah, I think it's really interesting what you say, because with the Science Media Centre, we ought to have scientists from universities, medical research charities and pharmaceutical companies, but we don't. And it's not actually a principle. It's not us, it's them, because the principal bit is that if we have scientists on our database, they must be on our database as an individual scientist with the right keywords, you know, immunologist, pediatrics, whatever, and we will go to them and ask them for third-party comment on new findings or a comment on some breaking news. And of course, pharmaceutical companies have never felt able to give us their scientists in that way. The press officers say, no, you can come to us and we will send you a line, or we will send you a quote. And that's not the way we work. So we've met over the years, we've met all the pharma companies and said, why can't you give us some of your scientists, your directors of research? And it's just never happened, and therefore they do fund us. Actually, we have didn't mention this earlier, but we have 120 funders who are all giving small amounts. So we do have some pharmaceutical companies funding us, but we don't have any pharma scientists. But interestingly, that changed a bit during the pandemic. I was very interested in that. So quite a lot of the trials, for example, like I said, these are kind of official government trials where they were commissioning universities or NIHR or NHS trusts. They would often have a pharma partner. So for the first time in 20 years, we did quite a few briefings where there was the university scientist, the NHS clinician running the trial, and the scientist from the pharma company. And on that basis, I felt like they were all great scientists and they were all working well together. But it was because I think for the pandemic, they were divorced from their kind of marketing comms people and just speak scientists. So that's something we'd be really interested in, getting more of their scientists. And it will be interesting to see whether post-pandemic, they are kind of released from their marketing comms role.
And just to add, for people who haven't seen the releases, that it's not press releases, but it's comments from the scientists on breaking stories, or sometimes briefing notes. The scientists always put forward any conflict of interest, don't they?
Yes.
So that's all. It's all very transparent.
Yes, I mean, sometimes they don't, but we say they don't. So we ask them a second time. And mostly they say yes, and it's all at every single roundup, you will see their conflicts of interest. And if they don't, but we feel like we need to get this comment out quickly, or it's an important comment, then we say, this give us a thing. And then we hope that the journalists will think, that's a bit strange, I'll look them up or whatever.
Okay, thanks, Fiona. I think Liza. Yeah, Liza's got a hand up.
Great. Thank you. It's absolutely fascinating to hear about your work, Fiona. And I'm sorry, I'm not ready for prime time at the moment, so I'm doing you a favor keeping my camera off. But my question is, I'm involved with coverage around the nexus of science, consciousness, and spirituality. And from what I understand is those scientists, they have a hard enough time getting recognized within their own universities. For example, I'm in Edinburgh, I'm American, but the University of Edinburgh has an endowed chair for parapsychology. So it's been there for decades, and they're a leading, academic function that's renowned all over the world, but getting coverage from what, let's just say, their ESP, anything having to do with parapsychology, is tough. So there's a few barriers from my research in this area. I mean, as a journalist, is that sometimes the psychology department doesn't really give them credibility, but the physics department does. But the press office won't really publicize this. And then I also wonder if there's a bias among journalists. I mean, what if the assignment editor doesn't believe in life after death or consciousness is outside of the body? I'm giving you some things that have been proven scientifically because I've had my head in that. So I would really love to hear from you, your thoughts on this. One of the things that was really helpful, what you said, was that you focus on news journalists. And many of the people who are science writers or even religion writers or health writers are writing in the feature section.
Yeah.
So I just wonder if you feel it's a really hard go for the news journalists to cover things like consciousness, near-death experiences, that sort of thing, or where might there be room to grow there?
Yeah. So I mean, one of the things about the Science Media Centre, which is in my career as press officer is unique, is that we are explicitly media driven. So, and that was because of the way we were set up, that there were lots of organisations who were choosing to opt out of helping journalists answer their questions because it wasn't in their strategic priorities, or, that what they wanted to do was invite media interest in a particular thing. And in my past life, that's exactly, I worked for an aid agency. I had to persuade news journalists to cover issues around international development and aid and debt relief for the developing world, etc. And it was very, very hard. One of the lovely things, which is my preamble to saying I'm not going to answer your question very well, is that the Science Media Centre's remit was, if the media are talking about it, you'll help them. So, for example, in the pandemic, there's 2 years when, as I was saying earlier, 1 million subjects were not covered in the way they deserve to be. So many, heart disease, cancer, climate change, just ignored for 2 years. But it wasn't the Science Media Centre's job to get those into the media despite. Our job was to respond to where the news media was, which was the pandemic, which was COVID. So having said that, one of the things I would say is that we feel that this model we've got, which is very unique because we don't care about our brand name, we're not linked to a particular institution, we are just an independent press office for science. One of the things I've done in the last few years is been on the steering committee for an independent press office for religion with a group of people who feel like the SMC model could actually apply to religion, where you would have people on the database so that journalists looking for somebody to comment on religious affairs or the religious angle of the war in Ukraine would get a list of credible experts. So I actually think that maybe the answer to this is just getting a few different kind of media centres where it doesn't matter whether Edinburgh University is promoting that, because there are other ways for those experts to be getting into the media.
Okay, great, thank you. Where does alternative health fit in all of this?
Usually with scientists criticising it, if I'm honest. So Edzard Ernst is on our list. He's a big critic, although I think, to be fair, the first time I met Edzard Ernst, who is a professor of the understanding of alternative health at Exeter, he did a speech, he won an award, and it was called The Good, the Bad and the Ugly. I always remember this, even though it was a long time ago. And the ugly was people who were opposed to all alternative health on principle. So the good was great science, the bad was terrible people pushing quack science, but the ugly was people who just write off homeopathy or write off different approaches without having tested them. And his unit in University of Exeter was actually running clinical trials on different approaches, including alternative health. And some of them came out very well, and some of them came out badly. So So, but I think mostly, we certainly, you know, when I say hands up, we're mainstream science, we would have scientists on who study alternative health, but we wouldn't have a section for alternative health unless they were good scientists.
Okay, thank you.
And just an add-on from that, Liza made a good point about, you know, the feature journalists. So obviously there's sense about science, but, you know, where should feature journalists who aren't eligible to go to the Science Media Centre, where should they go for the same type of information, would you say, Fiona?
It's a good point. And actually, Sarah was talking about current affairs as well. And I think we're age 20, we're having a bit of a discussion about, we've kept this focus on news. We're very good at news. It's quite helpful to have a specialism, you know, we're into specialism in science, and we're also specialists with news journalists. But because, as we were saying, that these, as Jacqui was saying, like these university press officers and other press officers have changed so much, they might be very narrow actually in promoting the corporate priorities of that institution. We are now wondering whether we should provide the same service for features journalists and for current affairs. For example, in the past, honestly, if a dispatches came to us, we would probably send them elsewhere. We see, I mean, I love dispatches, I love these, but they fit into the docs category rather than the news category. And now I'm thinking we're kind of reviewing that. So, and I do think, you know, certainly the health supplements of some of the newspapers. So I think Barney Kalman is the editor of all of the health output on the Mail on Sunday, including the 4 health features pages. And he comes to us a lot, he and his colleagues. So, and I do think sense about science. I noticed Sarah Owen is on the line, and Sarah and I are working on something at the moment about bipolar, a big announcement. And we've got a bit of a kind of division of labour going on where we're running a press conference for the science and health journalists, but there's a PR agency that is working with the Bipolar Society. Is it the Bipolar Society? I don't know if I've got the name right.
Well, can I ask?
Bipolar UK.
Bipolar UK. So they're good for Sarah. She's kind of got both of these angles covered.
Eva, did you want to come in there?
Yes, actually, it's a question on behalf of Paul Dinster, who has got, he can't connect for some reason. So he's asking that as freelancers have always been quite excluded from the Science Media Centre in terms of going to press conferences and things like that. So can you comment on that?
Yeah, so now I've forgotten his name, but he was a great member of yours who did a lot about the vitamin D and sunlight, the X.
Oh yes,
Oliver Gilley.
Oliver Gilley ran a 5-year campaign to get the SMC. And in fact, when he died recently, I sent an email to Jeremy Lawrence with my recollections of him, and he sent it to his wife, who I think she's a manager at the Observer, and apparently they both laughed and said, "That's Oliver for you." I think my words were, "He tortured me." So it's slightly to do with our roots and the fact that a lot of people were very, very skeptical about the science media when it set up, and very it was Susan Greenfield, who's quite a controversial character, who agreed to kind of set up the SMC. And she kept saying, you know, it will finally help medical journalists to do their job properly. And she was making all these absolutely announcements. And a lot of really seasoned specialist journalists were writing, we've got our own contacts, we don't need a science media. So it was partly a kind of defensive mechanism that, you know, we're not for you. Oliver Gillies, you don't need us, we know that. You know, Nature News journalists, we know you don't need us. Research Fortnight. But like I was saying earlier, these young journalists who get a job on the Telegraph as the science editor, who were previously the sports correspondent, they really do need something like us. And of course, at the same time, you know, this was the days when Jacqui would write one article for the Telegraph for the next day, one article for the print version the next day, and suddenly we've got 24-hour news and we've got online media, and people are saying, oh God, I've got like 5,000 words I've got to fill by 2 o'clock today, you know, online. So everything was changing, and we made a decision at that time. The people that need us the most and the people that we're going to service are news journalists. And so these freelancers who are often like you guys have worked on health journalism for 30 years. You would be teaching us. It would be an absolute insult to all of you to say that, you know, what you need is a science media centre. Again, that has changed a lot. We now, and I don't think we could have said this at all in the first 10 years, we are now sometimes running press briefings that to exclude you from those press briefings is problematic, because it might be the national announcement of a new clinical trial. So I think things have changed, and we've got a lot more journalists, freelance journalists on the list, a lot more than we used to. But I think my arguments with Oliver were reasonable, and there were freelancers coming who were asking long questions in a very brief 20-minute Q&A, with all the news journalists going mad saying, hold on, we want to know the line for so there was various ways in which we wanted to establish our credentials as news. And by the way, always from day one, if a newspaper wanted to send a freelancer, that was always fine. If the Daily Mail said, all of our science and health journalists are busy, can we send Paul Dinsdale to write this up? It was an automatic yes.
Yeah, and of course, you know, I've attended as BMJ freelancer again, so in a similar way. Just to say, from my point of view, for anyone who doesn't know, the website for the Science Media Centre has all of the scientists' comments on loads and loads of subjects. So that's a really, really useful resource whenever you're covering anything. It's yeah, very, very helpful. We've just got maybe time for one more question, and then I think we need to let Fiona on her way and finish off her glass of wine. Are there any last questions? Yes, Ursula. Thank you.
Thank you. I really enjoyed that. I write about nutrition, and nutrition by its nature is not sharp-end science, because you can't really ever do the definitive trial, or only with great difficulty. So it's always going to be slightly muddled. And a frustration is that you get a constant ping-ponging of messages of red wine is good for you and red wine is bad for you, and chocolate and dairy or not dairy. So there's a constant swirl of contradictory messages, all of whom you can hinge an expert professor onto. So it's not as though it's just, you know, film stars making these comments. It is respectable academics, but it just bounces round and round. And the sort of story about healthy eating, eat more fruit and veg, is snoring, boring, and will never get, you know, any feature because it's so over familiar. But my question is, what are your observations, or what is your advice to people or health professionals, to journalists who are trying to convey valid scientific information in a subject that, as I say, has got 10 million clicks whenever you Google anything in terms of contradictory stories? How can you communicate valid messages with some hierarchy as to how consumers can then understand how to apply these messages into their own lives?
Yeah. Oh, how long have we got? We haven't got long. I feel that actually, if you'd have asked me a neutral question of like, what is one of the hardest areas, I would have said diet and nutrition. I definitely would have, for exactly the reasons you say. It is, everybody's got a view on it. It's, as you say, you can become a nutritionist by, you know, a few things that you don't have to become a professor. And it is a daily diet of kind of contradictory claims. I mean, part of this actually doesn't lie with any of us, because I think, you know, the Science Media Centre, we all the diet and nutrition experts on our database are good. They publish in peer-reviewed journals. As you rightly say, like even the science, it's observational. You can't do randomized clinical trials where you give someone red wine and someone. So it's already a difficult area, but I still think that there are some people who do research and do science, and some people who don't do any research. And I would like the public to, if they are confused and they want to know more, to look at people who've been researching in this area and actually test their theories in well-designed experiments. But some of that is about educating the public as to what to look for. And I think that's the perennial thing. We can, between the press officers like me and the good journalists like you, we can work out how to convey where the weight of evidence lies, and we can, but there will always be stories appearing that look like, my mum used to, she's died now, but she used to drive me mad when I went into science. She was like, well, how am I meant to know? You know, this person came on and said this, and then the next person, and I look at this, I'm saying, who's this other person? And it's, you know, it's some absolute random. And I say, but mum, because one of them is a scientist at Bristol and has been doing research for 30 years, and this other person is not an expert at all. Like, but it was very difficult for her, and often that expert was called something that sounded very expert. I mean, the number of people, don't we have like National Commission on Obesity, and people can set up, call themselves names that sound very official. So basically, we do our bit. Every time there are new significant findings coming out about a health claim or nutrition or diet, we go to good experts and ask them to help the journalist and then help the reader. So help the journalist by saying, this study is a beautifully designed study from our friends in Edinburgh University. It's you know, the caveats are made clear, but journalists should point out that it contradicts the previous 10 studies. So it should be taken with a bit of caution. So there, what you're doing is you're helping the journalist to navigate, to put this in the paper, maybe to quote some of those third-party experts saying, great science, but here's the caveat. And then hopefully that's one way of doing it. But it's very difficult. We always used to say, I don't know if you remember this, Jacqui, but we always used to say as well that when we did brief it, actual press conferences on diet and nutrition, it was one of the ones where even the journalists would kind of put down their notepad and pen. You know, if it was something about climate change, they'd be like writing down everywhere. But if it was about diet and nutrition, they would just put down their notepad and say, yeah, but I'm sorry, but I think that, you know, I think that the big problem is processed food. It's an area where people just have such strong opinions themselves. So yeah, I'm not answering your question at all, Ursula. I am sympathizing with the dilemma and being glad that we have journalists like you who worry about this kind of stuff.
But I wanted to know whether white wine was good for you.
Yeah, when you were saying there, one study says red wine is good for you and one is bad for you. I mean, the other thing, I have this argument with my husband as well a bit, who does that kind of, you know, woe is me, what's the point when you're all saying different things? But actually, the other thing is that you can have two very, very good studies coming to different conclusions. To me, what matters is not the conclusion, because they probably asked the question in a different way. They may have asked it to a different group of people. They may have put different kind of design methods in. It doesn't mean, and it may mean that red wine is good for you in moderation to prevent heart disease, but very bad for you in the way I drink it, which is 4 or 5 glasses over. So it doesn't. It's also not intelligent to say, because different scientific studies come to different conclusions, we shouldn't believe any science. I think he does it just to wind me up.
Yep, thank you.
Thank you, Fiona. That's a very nice note to end on. I have to say thank you very much indeed for giving us up your time today. And again, you know, everyone, go and have a read. It really is a fascinating book and analysis of science.
Can I say one more question for Paul? Sorry, he's doing it through me.
Oh, go on then.
Have you got any reviewed copies of your book? This is a question from Paul.
Oh yes, most definitely. You could, yeah, you don't have to pay for it. Please just email me and we'll get the publisher to send you a copy. Totally. You're all journalists. Very happy to do that.
Paul, I'll get that email to you. But yes, and talking of wine, as I said earlier on, remember the networking event sponsored by Yakult and it is on the next Thursday. And so I think it's 6:30 till 9:30. Jatinda's nodding, so it'd be lovely to see you all there and have a catch up. So thanks, Fiona. Good luck with everything. Here's to the next 20 years.
Thank you.
Centre. I think I may have retired by that point.
Hope not.
But yeah, hopefully there was somebody to carry on, and yeah, it'd be great to see you again.
Thank you so much, and I really enjoyed that, and I really appreciate you inviting me to this. Good luck.
Great. Okay. Bye everyone.
Bye everyone.
See you next week.
Bye.